Well, if you are someone who suffers from common mental health conditions, this next story could be the answer you are looking for.
New research involving the use of psychedelics could be the key to treating an array of disorders, including depression, anxiety, PTSD, OCD, and substance abuse.
And Stephanie Valderrama is joining us now live with more on the studies currently being conducted. Steph?
Well, Matt, Sam, the use of these psychedelics would be in a very controlled clinical setting, and it would be targeted more at people who have become resistant to more common treatments, things like therapy and medication that either stopped working or didn't work to begin with. So Dr. Brian Barnett explains this research is really making a comeback after setbacks in the 70s. He tells us research being conducted by Johns Hopkins using Psilocybin, that's the compound found in magic mushrooms, for treatment of mental illness, and also clinical studies being conducted by Cleveland Clinic are proving psychedelics such as psilocybins and LSD could be a promising alternative to treat a number of conditions. So in a sense, think of it as a reset for the brain, rewiring and restarting connections.
When patients receive psychedelics, they're not going home with them. I don't think there will ever be a point where the FDA says you can send a patient home with this. We know these are extremely powerful drugs. They're the most powerful drugs that exist. And safety is really important.
So these clinical trials are extremely controlled. Patients are provided the medication under the supervision of an expert who stays with them the whole time. And as you can see, people feel relaxed. They listen to music, which Dr. Barnett explains is very helpful in guiding a patient through the intensity of the psychedelic experience. Now, this is really interesting. According to Dr. Barnett, a study that he actually reviewed shows about 50% of patients had not experienced anxiety 3 months out from a single dose. So that's not to say that they are cured and those symptoms won't come back. Of course, this is what this research is looking to further investigate. And most importantly, there are a lot of challenges in order to bring this to the masses, the biggest one being, of course, FDA approval. Matt, Sam?